Welcome to the Nutrition Research Update from the Renaissante Institute of Integrative Medicine. Hi, I'm Dr. James Meschino. Our topic today is the natural management of chronic inflammation. Now, you see chronic inflammation in many different conditions: osteoarthritis, rheumatoid arthritis, other autoimmune conditions that affect the joints in particular, sites of old injuries, overuse syndromes at the elbows, the wrists, the hands, after a whiplash injury, people with chronic recurring low back pain that really starts to, become a day-to-day problem for them over many years, and lingering problems with bursitis, tendinitis, fasciitis. All of these chronic inflammatory conditions have certain principles in common. Now, the good news is that there are some natural remedies that have been proven to suppress that inflammation so you feel better and you're more functional. Now, many herbal supplements, for instance, have been shown to have anti-inflammatory effects in experimental studies, but very few have actually been shown to be effective in human clinical studies. So if you're going to use supplements, you want to use ones that have been proven to work in humans, not just in animals or in a petri dish. So the herbal supplements that have the very best clinical studies behind them in terms of reducing inflammatory problems in humans are curcumin, boswellia, white willow bark extract, and ginger. The active ingredients in these herbs block really the same enzymes and chemicals that are blocked by aspirin and ibuprofen and Voltaren, indomethacin, Celebrex, and those types of anti-inflammatory drugs. The difference is that the herbal agents don't damage the stomach. They don't lead to bleeding, internal bleeding, and irritation and ulceration. They don't damage the liver. They don't damage the kidneys. That's why you should try to rely on these things as much as you can and try to avoid the drugs that are doing internal damage. In fact, one of the major side effects of some of those herbs that I'm mentioning is that they have very important anti-cancer properties as well. So these herbs are multimodal in their health-promoting effects, but one of the great effects is that they have anti-inflammatory behaviors. And so how do they work? They actually block these enzymes. One is the cyclooxygenase and one is the lipoxygenase enzyme. They inhibit what's called tumor necrosis factor alpha. All these major chemicals that are involved in the inflammatory process that pharmaceutical companies try to block with their synthetic drugs. There are natural things like curcumin, boswellia, white willow bark extract, and ginger that do it with natural agents without the side effects. But you have to be using the right standardized grade and the right dosage. So for curcumin, you'd need to get a supplement of turmeric that is a standardized grade of 95% curcumin content. Otherwise, it's going to be useless. With boswellia, the supplement has to be 70% boswellic acid. It needs to be that standardized grade. That's the one that's been shown to work. With white willow bark extract, has to be a standardized grade of 15% salicin or salicylic acid. And for ginger, it has to be a 5% grade of gingerols, these anti-inflammatory resins. So my suggestion is that you get a supplement that contains curcumin, boswellia, white willow bark extract, and ginger, using those that have those right dosages and standardized grades in them. And then you take as many capsules as you need to suppress the inflammation. So depending on the severity, you would take 1 to 3 capsules 2 or 3 times a day to get the inflammation down. And then once the inflammation's down, you might be able to go off it altogether, or just wean yourself down to the lowest dose that helps to maintain improvement. Let's say you have something chronic like rheumatoid arthritis or osteoarthritis. You try to find the lowest dosage that's going to work for you. Other things that work in concert with those herbs, one of them is essential fatty acids. The combination of flaxseed oil with fish oil with borage seed oil helps the body make these anti-inflammatory prostaglandins that also suppress inflammation. And to make those essential fatty acids work optimally, you need a high-potency multiple vitamin that gives you the antioxidants and the B vitamins and the magnesium that work as cofactors to help your body make the anti-inflammatory prostaglandins from the essential oils. So that combination of flaxseed, borage, and fish oil all in one combination product, you take about 3 capsules a day. That usually has a very good anti-inflammatory effect. In addition to that, you need to have an anti-inflammatory diet. There's some foods that actually provide raw materials from which the body will make more inflammatory chemicals, and you'll make yourself worse. So you need to minimize or avoid those foods as much as possible. The final part of controlling inflammation is actually to have good chiropractic care. Chiropractors can find the mechanical joint and muscle irritation components that are encouraging the inflammatory process and causing stiffness and irritation. And they can, with hands-on treatment and other modalities, improve joint function, get you more functional, moving more properly, and reducing some of that irritation. They can also eliminate many of the muscle triggers, the fibrocytic nodules that build up in tissues, eliminate the contractures that cause pain, and also promote the inflammatory cascade. Supplements and diet alone cannot get rid of those problems. That's why chiropractic care is so important, to establish the biomechanical disturbances, reestablishing normal joint function and muscle function. Now, to see the exact diet and supplementation program to reduce chronic inflammation, I'd suggest that after you watch this video, view the recommendations below, and you'll see it's all spelled out for you very neatly and flawlessly. So I hope you found this to be very helpful, and thanks for watching, and I will see you next time.